So the bottom line is that this order has been issued for the good of testing people and making sure we keep people safe. That being said, the testing in this county has been increasing over the last several weeks. We now have nearly 46 testing sites available all over the county, and a lot of people have been coming for testing. I must say that at this point, the County of Santa Clara and VMC has really borne the brunt of testing those in the community, with drive-through sites, testing at the hospital, and other sites that have been set up as mobile units. That doesn't mean that there isn't a lot of other testing being done. We have our, what we call our pop-up sites, our Verily sites, our OptumServe sites, and we also have the community clinics, where we, excuse me, where we really have seen the numbers not coming up to meeting what we really feel is necessary so that we can meet our goals, is testing by our large healthcare systems. And that has occurred for a number of reasons. A lot of them are well-meaning. They want to do the testing. They've come up against a number of barriers, and these barriers are being worked on, such as testing kits and reagents, the chemicals that they use. However, it's just not happened. We just have not seen the numbers being generated by our large healthcare systems. And so this order basically is ordering that these large healthcare systems, basically the hospitals, all hospitals and their associated clinics, that they provide testing to 3 groups of people. 1, those that have symptoms of COVID-19 and show up in their system no matter where. Number 2, those people who have been exposed to a known case, a confirmed case of COVID-19, and have been told to go get tested so that we can contain further that potential infection. And thirdly, and again the largest group, are those people on the front line. Those are the people that are at risk, putting themselves at risk every day, working in the grocery stores, driving the buses, working in pharmacies, and other frontline types of work. So those people need to be tested on a regular basis. And our guidance changed nearly a month ago, basically recommending that those people be tested. So this order will help guarantee that all of those people who are members or who are patients of these healthcare systems, and that represents well over 1 million people in this county, are covered by one of these healthcare systems or hospitals. And so this is a joint community effort. The county can't do it by itself. The small community clinics can't do it by themselves. But the large healthcare centers, the large clinics in this county need to step up and help provide additional testing so that we can meet our goal. We have been testing anywhere from 850 to over 3,500 people a day. That averages out to about 2,400 a day, but it still doesn't meet our goal. We really want to get up to the 4,000 and beyond tests per day. And we just can't do that alone. So we need the help. We ask everyone in the community to join us in this effort. And we feel it was necessary at this point to issue this order so that we, again, can do all we can to protect the people of this community so that they can have access and availability of testing in Santa Clara County. And we think this is the right thing to do. Most of the hospitals and clinics are already doing this. The numbers are slowly going up, but they're not there yet. And we feel that we need to issue this order so that we can, again, get those numbers up and get people protected. So I'll stop there. And Jeff, would you like to say anything or question?
I think the main message today is that we want all of the citizens of the county to understand that it's important for them to get tested if they fall into one of those 3 groups. Either they have symptoms, or they've been exposed to somebody who has COVID, or they work on the front lines, which means that they're around clients and others quite often by necessity. And we want to make sure that the insurers that are responsible for their health care know that they're going to be coming in to ask for tests. And we want to make sure that we provide the incentive to motivate everyone to get the testing they need. This county is lucky in the sense that a large portion of the population is insured, and that's fabulous. However, one of the downsides of being insured is that your access to health care is determined by somebody else. And what we're trying to enforce today is that in the midst of a public pandemic, a crisis, we want the individual patient, the individual resident, the individual who's at risk to make sure that they take responsibility for getting the tests that they need and they have the access that they need to get that test. We've been for a number of months now telling residents to call their doctor if they have symptoms or if they're concerned, or call their health system, or call the advice nurse. In this order, make sure that when they do that, they'll get a yes when they ask for a test. So that's what we want to do. We're not trying to be heavy-handed. We just want to make sure that everybody who needs a test gets a test, because it's a dangerous time right now, and the only way that we can protect the community and protect the residents is with testing and appropriate tracing and isolation, as Dr. Finsterscheib said. So with that, I guess we'll open it up for questions.
Dr. Finsterscheib?
Yes.
Can you tell us what percentage of the testing that's been done so far has been done by these large healthcare providers?
It's a small number. Again, as I mentioned, the brunt of these have been done by Valley Medical Center and all of its clinics. So we can get you the exact numbers. I don't have those all in my head, but it's a small portion of the total tests that have been done. So again, when they ramp up and meet the demand that their patients have, then we will surpass the number that we need to in order to protect this community. But we want to make sure that everybody who is covered or who isn't covered has the capacity to find a place to get a test and can get a test on demand.
So far have there been many instances in which individuals have gone to their healthcare providers in the county asking for a test and were denied?
We have certainly heard incidences where mainly people who have been asymptomatic, who have shown up and just said, you know, I have no symptoms, but I think I'm at risk for whatever reason, and have been told that that there's no capability for them to be tested. So this isn't across the board. You know, I'm not saying that they're not doing it, that these systems are not doing any testing, but they're just not doing them to the level that we really need in this county to be able to move forward and not see the hospital beds fill up and ICU beds fill up, and we can go back to a really, really effective containment strategy and stay safe.
Yes, question over there?
That was the same question.
Okay.
Thank you.
Thank you.
Have you given these healthcare providers goals that they need to meet? I mean, how are you going to assess whether they're adhering to the order?
Well, the whole idea is that this is not a punitive type of order. So we're working together. We were on a call yesterday with the hospitals. The state was on the call also because there's some issues about having enough of the chemical reagents, and the state is willing to help in providing those or finding them for them. So we're not really holding them to a number. We just want them to make sure that they meet those criteria, and for their own members or patients, if somebody comes in with symptoms who is a contact or says, I work at a grocery store and I'm constantly being exposed every day of my job, I need to be tested, that they're tested. So that's what we want foremost.
And you had mentioned the grocery store workers. How often do you recommend they get tested from the other frontline workers?
Right. In our guidance, we have recommended that those workers on the front line be tested at least once a month. but no more than every 2 weeks. So it's not something we're saying every day you have to run for a test. We do not want people to do that. But if you're working on the front line in any of those categories, get yourself tested at least once a month.
Some local leaders have said that another bottleneck for testing at this point is that not enough people know where the test centers are, or they're not aware that they are expected to go get tested. Given that bottleneck, is the issue with the healthcare providers, is that really the most pressing issue facing the county at this point, or are there other issues that are pressing as well?
Well, it's a mixture of a lot of things. I mean, we are doing our best to increase the demand to get the word out. Not everybody is on social media. Not everybody watches TV. We're in the communities, in our hardest hit communities, such as on the east side of San Jose, up in the north Mountain View area, down in Gilroy. We're boots on the ground there. But we're using any means we can to get the message out. And we are hoping that the large healthcare systems also, through their mechanisms of reaching out to their members and their patients, will also provide them with the incentive, if they meet these risk categories, to come on in and get tested. That's the only way we can do it. Community-wide effort, everybody on board, everybody working toward the same goal.
Had you hoped to reach a higher average test per day level at this point?
Yes, I really did. When I was asked to come on and do this, we were asked to meet the original number of 200 tests per 100,000, which was 4,000. And as I mentioned, even though our range has been close to that 4,000 at any number of single days, on average we haven't gotten up to that number yet. There's nothing magic about the number. We probably have to go far beyond that. It's more important, of course, where we test and who we test. So we want to be in those areas that are highly impacted, and we also want to test those people who are most at risk. And certainly the people with symptoms, and certainly all of those contacts that we're going to find from every one of these cases that are identified.
So the more people that you test, the more cases you'll find, more confirmed cases you'll get. So is there a percentage of the number of tested people that have been diagnosed with COVID-19, not just the overall number, but the number of tested?
Well, that's the positivity rate. And so the positivity rate, meaning how many of the people you test, how many of them turn out to be a positive test. And if you look at the whole county, the number is pretty low. We're in like 1 to 2% positivity. But if you look at areas, say, in East San Jose, they're as high as 6-7%. So again, it depends where you go. That's why you need to focus on the areas where people are most at risk. So we want to keep that positivity rate low, but we still have to test. And we will for sure find additional positives in cases, because then we'll know that we're doing enough testing. And then we can contain them and keep that from spreading and causing hospitalization numbers to go up and widespread outbreaks, which we don't want as we open up.
Marty, is there a possible connection between the new order and the timing in terms of reopening? Loosening of the previous orders?
Well, I mean, I think reopening in general requires some attention paid to what we can then offer the community. So re-emphasizing, and I'll do that right here, that people wear their mask, their facial covering when they're out in public. It's really important to do that because you're protecting the person that's across from you, and they will be doing the same to you. Washing your hands, social distancing, and then the testing. So as we open up, and we open up even more down the road, we have to include all of these protective measures, and testing is certainly one of them.
As you know, we've had recent protests involving hundreds of people. Many of them were wearing masks, but many were not. Do you have any advice for people involved in those protests on whether they should be tested?
Yes. So as far as the protesters, they, again, are out there and they have their right to do that, and that's absolutely okay. From a public health standpoint, we worry about them. We look at the pictures and we see some people with no masks and people who are very close together, other people that are screaming and potentially spreading the virus. So yes, we recommend that those people be tested. I would say sometime about 3 to 5 days after your last exposure in some type of protesting gathering, because the virus needs a little bit of time to incubate before we probably can get a positive test out of it. But yes, if you were in a protest and with a large gathering of people, get yourself tested.
Are there any healthcare providers in particular that you think should be doing more? I remember at a recent meeting of supervisors, I think Kaiser was identified, a couple of other local ones, any that you would say really should be doing more at this point?
Well, in this order, we're basically saying all the healthcare providers. So without singling them out, yes, it's Kaiser, it's PAM, it's Stanford, and all the rest of the hospitals. As I say, the one organization that has really stepped up to do more than their share has been Valley Medical Center. And so the most of these numbers that we're seeing in our testing levels have come because of Valley Medical Center, which means that if Valley Medical Center can do it and find the reagents, then any of those other systems can do the same. And with the help of the state, they should be successful in maintaining a high level of testing.
Thank you very much.
Okay.
Thank you.
Thank you.
And I'm going to just say a few words in Spanish. Buenas tardes, mi nombre es David Campos, soy ejecutivo adjunto del Condado de Santa Clara y hoy estamos anunciando la presentación de una nueva orden de salud pública que la oficial de salud pública del Condado de Santa Clara, Clara Co, acaba de presentar. Esta orden de salud pública requiere que las instituciones grandes de hospitales del Condado de Santa Clara, las instituciones privadas que provean pruebas de COVID-19 a sus pacientes. Estamos hablando de organizaciones, hospitales privados que cubren más de la mitad de la población del condado, más de 1 millón de personas. Esos hospitales, esas instituciones sirven la necesidad médica de sus miembros y ahorita, desafortunadamente, estas instituciones no le están proveyendo a sus pacientes, a sus miembros, el número de pruebas de COVID-19 necesarias para poder contener el virus. La gran mayoría de pruebas que se han hecho en el condado y que se hacen cada día son hechas por parte del condado de Santa Clara, no por parte de hospitales privados. Entonces sabemos como condado que para poder tener el número de pruebas necesarias para contener este virus, es necesario que no solamente el condado haga estas pruebas disponibles, pero también estas instituciones hagan esas pruebas disponibles para sus pacientes. Así que hemos tratado de trabajar con estos hospitales, con esas instituciones, pidiéndoles de que hagan más pruebas disponibles a sus miembros, a sus pacientes. Desafortunadamente eso no ha ocurrido y es por esa razón que hoy estamos ordenando con esta orden pública que estas organizaciones y instituciones médicas de hospitales y sus clínicas afiliadas que le proveen pruebas de COVID-19 a cada uno de sus pacientes. Y estamos enfocando en 3 clases de personas. Primeramente, las personas que tienen síntomas del COVID-19, esperamos que esas personas reciban estas pruebas. Segundamente, personas que han sido expuestas a alguien que tenga COVID-19, esas personas también necesitan recibir la prueba de COVID-19. Y el tercer grupo son personas que, debido a su trabajo, se exponen cada día, están en las líneas frentes trabajando y por ese trabajo son expuestas a este virus. Esas 3 clases de personas, de categorías de personas, necesitamos que estas instituciones les hagan los exámenes disponibles, los exámenes de COVID-19. Es la única forma, con la cooperación de estas instituciones, que como condado podemos hacer el número de pruebas necesarias y no solamente el número, también en los lugares necesarios en las comunidades más afectadas. Muchas gracias.
Can you just say your name and title again, just so they have it connected with you?
Yes, David Campos, Public Information Officer for the Emergency Operations Center for the County of Santa Clara. Thank you.